With me now is America's point man on infectious diseases, Dr. Anthony Fauci. He's been the director of the National Institute of Allergy and Infectious Diseases since 1984.
And next we have Knut Wittkowski. Welcome, Knut. Very good to see you.
Thank you for inviting me.
Yes, we're so glad you're here. Dr. Knut Wittkowski is head of biostatistics, epidemiology, and research design at the Rockefeller University. He studied at the University of Tübingen
In Germany.
Where he received his DSc in medical biometry. Please pardon my mispronunciation of these words. His dissertation is entitled Knowledge-Based Support for the Analysis of Inexact Data. That sounds very interesting. I'd like to learn more about that. He's been published in the American Journal of Public Health, and he has earned a PhD in computer science from University of Stuttgart. Pronounced it okay?
Mm-hmm.
Okay. For over 18 years, Knut Wittkowski has served in various distinguished positions. He's a consultant at the New York Academy of Medicine. He's an associate at HIV Center for Clinical and Behavioral Studies. He's a guest researcher for Centers for Disease Control. And in addition, he is president of ASDERA.
Dr. Anthony Fauci, thank you very much for joining us. As we sit here, middle of March, what is your biggest concern about this coronavirus pandemic?
My concern is, and I hope it goes from a concern to a realization that we're doing what we should be doing, is that we really need to take the recommendations and the guidelines of how to mitigate the spread of this very, very seriously.
You mentioned in the piece that, in fact, you think containment would prolong the duration of the virus.
Yes.
Can you talk about that?
With all respiratory diseases, the only thing that stops the disease is herd immunity. About 80% of the people need to have had contact with the virus, and the majority of them won't even have recognized that they were infected, or they had very, very mild symptoms, especially if they are children. So it's very important to keep the schools open and kids mingling, to spread the virus, to get herd immunity as fast as possible.
So what Dr. Birx has really said very simply is that there are really two dynamic forces that are opposing each other here. As I've mentioned several times in our briefings, the virus, if left to its own devices, will do that dark curve that Dr. Birx showed you. The other dynamic force is what we are doing, what we're trying to do, and what we will do in the form of mitigation.
There is no evidence around that doing any of these antisocial separation or prohibition or whatever you call it has any effect on the epidemic. With one exception, it flattening the curve, what people try to do, is broadening it. And that means it takes more time. And if it takes more time, in the end, you are putting more people at risk because nobody can, for extended periods of time, follow these draconic strategies or measurements.
I get questions a lot, Dr. Birx and I, about these numbers, the projections that you went with from 100,000, 200,000, now down to 60,000. That's a sign that when, as I keep saying, when you take the data you have and you reinsert it into the model modifies. Data is real, model is hypothesis. If back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. And with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now. So if that means getting back to normal, then we'll get back to normal.
Going into a month now of lockdown or more, we're looking at a few more weeks to say in the end of April. How long would this entire thing have lasted had we gone with your approach and just said, hands off, let it run its course like other flu seasons. How long to reach that herd immunity point in your mind?
It would be over.
We'd already be through it.
Yep. The same way it did in China, it did in South Korea, it did in Australia, it did in Austria. We have lots of these examples. This is what the epidemics do. And there is no reason to expect it would be fundamentally different in the United States. It may take a bit more time because the United States is so big, so the virus doesn't get everywhere at the same time. There's a delay of a couple of days before it gets from one place to the other. And therefore it can take a bit more time, but that's not a major factor in the whole discussion.
It's not the first coronavirus that comes out, and it won't be the last. And for all respiratory diseases, we have the same type of an epidemic. If you leave it alone, it comes for 2 weeks, it peaks, and it goes for 2 weeks, and it's gone.
The showstopper will be obviously a vaccine where you can vaccinate people and you won't have it. There's going to be another issue that's going to be important, and it has to do with somewhat of a comparison, for example, with influenza. We go through multiple cycles of influenza. There's always a degree of background immunity in the population. I mean, that will ultimately happen if we get a situation where we get back to normal. Now, I hope we don't have so many people infected that we actually have that herd immunity, but I think it would have to be different than it is right now.
I looked into a claim that people make that in China and South Korea, the social distancing had successfully helped to control the epidemic. I looked at the dates when people actually started social distancing. In China, the epidemic peaked on February 1 to February 5th in that period. But the schools were not closed until February the 20th. That was 2 weeks later. In South Korea, we have a similar pattern. In Daegu, or however that city is being pronounced, where the church of Shinchenyoi had that outbreak, the self-quarantine was ordered only on February the 23rd, when the peak in that city happened. The national distancing was not advised until February the 29th, so that's a week later, when the national peak happened. So both in China and in South Korea, social distancing started only long after the number of infections had already started to decline and therefore had very little impact on the epidemic. That means they had already reached herd immunity or were about to reach herd immunity. They were very close. But by installing the social distancing, they prevented it to actually getting to the final point. And this is why we're still seeing new cases in South Korea several weeks after the peak.
Would this possibly become a seasonal cyclic thing? And I've always indicated to you that I think it very well might.
Can you imagine a time where Americans carry certificates of immunity?
You know, that's possible. I mean, it's one of those things that we talk about when we want to make sure that we know who the vulnerable people are and not. This is something that's being discussed. I think it might actually have some merit.
We keep hearing about a second wave, that we now have to prepare for the second wave probably coming in the fall. Do you predict that that's something we should be preparing for? And how do you think we should prepare, if so?
We should prepare by stopping the prohibition as soon as possible. and then we have a good chance that there will be no second wave. If there is a second wave, it is because the shutdown was preventing herd immunity to build, and then if the summer is over and people stay more time indoors, then the virus will start spreading again. And the way to prevent that is to let the virus run its course right now and be done with it.